Coming up next on Democracy Does, the Civic Power Playbook.
I always like to tell people, please, please do not count yourself out. Medicare is confusing. Our healthcare system is difficult to navigate, but don't count yourself out. Ask questions. If you hear something from someone that may not be accurate, please, reach out.
That's up next.
Hi, everybody, and welcome back to Democracy Does, the Civic Power Playbook. Today, we have Frederick Riccardi. He is president of Medicare Rights Center, an organization making sure that older adults and people with disabilities get the access to the affordable health care they need. First of all, thank you so much for being with us.
Thank you, Robin. I'm pleased to be here today.
And thank you for all of the work you do. It's so important. And we are at a place right now where it's critical. I'll just leave it at that. Just talk about the work that you do in a nutshell, about how you help people with disabilities or who are older get what they need. Tell me about your organization.
Yeah, the Medicare Rights Center has been around for over 35 years, and we're a national nonprofit organization, and we run a helpline where we field questions and problems and concerns from Medicare beneficiaries. So for your audience, in case they don't know, these are older adults and people with disabilities who qualify for Medicare coverage, but also their families that have questions about Medicare. Maybe they have a problem enrolling, have trouble affording their coverage. And so we run a helpline where we are able to provide Medicare counseling. And then we also help people enroll into benefits to afford their coverage. We have educational programs. So just to make sure to check out our website, MedicareRights.org and MedicareInteractive.org for Medicare information. But what we do as the heart of our work is run this helpline and learn from people on Medicare to help then influence public policy. And we have a number of priorities to help improve the Medicare program to make it more accessible and to make it more affordable for people. And so that's why I'm so pleased to be here with you today, because as you know, our healthcare system is very complicated and Medicare can be very confusing. And so the recent passage of this bill has a number of very concerning and dangerous provisions that were included in it. But I want to make sure that we're also really clear about what's not changing too, because we are starting to field questions and calls from people on Medicare who are very concerned about their coverage.
I'm really glad you mentioned that because I want to ask you about the new bill that came out. The numbers are astounding. Who is going to get kicked off? Who is going to lose their coverage? What is changing and what's not? So let's start with, how is the bill going to impact people that you interface with regularly?
Yeah, and so our helpline, we serve older adults, we serve people with disabilities. These are individuals who are enrolled in Medicare or eligible for Medicare coverage. But a large percentage of our clients are also dually eligible. So these individuals are dually eligible for Medicare and the Medicaid program. And so they're enrolled in both programs, which allow them to access their healthcare services, prescription drugs, and also other types of care, such as long-term care, skilled nursing facility care, nursing home care, et cetera. And so the Medicaid program and other benefits that help make Medicare more affordable are extremely important to people. And some of those programs were included in this bill, and there's major changes. I've been thinking about this bill in the form of trying to demystify and also break down a couple myths.
Okay.
And I think there were two key myths in this bill that passed. The first myth is that the elderly and the vulnerable were going to be protected. So those that earned or deserve benefits would not be impacted. But that is not true. And I can talk to you a little bit about that. But
Yes.
the other myth that I want to bust is that the bill supposedly was not about cutting Medicaid benefits or cutting people off from Medicaid or health insurance and only targeting fraud, waste, and abuse. But that's not the case either. And so the big takeaway is that there are huge cuts to the Medicaid program, and they will also disproportionately impact older people, people ages 50 to 64, but they're also going to impact older adults and people with disabilities that are enrolled in the Medicare program. And that is what is so disappointing about the passage of this bill.
When you talk about hurting the people who are older, what does that look like? Does that mean someone won't be able to get their drugs? Does that mean someone's not going to be able to get their annual physical? What does it look like in concrete terms?
So in concrete terms and practically speaking, so just the other day, I spoke to someone who has to take an extremely expensive prescription drug. And the drug was going to cost $2,000 out of pocket. This person was not enrolled in prescription drug coverage, and they're very low income. And so we're going to be able to help this person enroll into a program that's called the Medicare Savings Program. It's going to lower the cost of their Medicare coverage because, for your viewers, your listeners, Medicare coverage isn't free. That's often a surprise to individuals, but there's a monthly premium. It's $185 a month. And then there's also the cost associated with the prescription drugs. Fortunately, the cost of prescription drugs were lowered by the Inflation Reduction Act, but they still cost, up to $2,000 out of pocket for the whole year. My organization and organizations throughout the country help people enroll into something called the Medicare Savings Program. It pays the $185 Medicare premium. It lowers the cost of prescription drugs to very reasonable co-payments. And what this bill does is it cancels out a rule that was going to help approximately 1.4 million people access that program seamlessly. So this bill cancels that out. That means there are going to be $1.5 million, 1.4 million people who are eligible for millions of dollars in premium savings and drug costs that are going to have to spend that money because of this bill. That's just one way that low-income people with Medicare are going to be impacted. They may never learn about this benefit, even though they're eligible. And so this bill eliminated a provision that was going to enroll people into these programs automatically. So that's gone.
So they won't be automatically enrolled, and they are creating an additional barrier so that it's harder.
They may never learn about the program. They're not going to enroll in it. And so practically speaking, what does that mean? That means they are going to have a lower Social Security check, even though they've been eligible for this program and they should be enrolled. So they canceled that rule. It also makes their prescription drugs more expensive. These are individuals that should be paying, less than $15 for a drug that are going to have to pay, up to $2,000 a year for their drugs just because they're not enrolled into this benefit. Because when you enroll into a Medicare savings program, you have your Part B premium refunded, and you also have your drugs lowered. And there's a benefit of, approximately, $6,200 a year just to have your prescription drugs lowered like that. What it also does is it imposes work requirements onto people who are enrolled into Medicaid. And disproportionately, that's going to impact older people, age 50 through 64. And it's not as if people are not working. It's about putting barriers in place to keep people on coverage because it costs money to have people insured. And so the mere fact that someone has to prove that they're working, submit paperwork, submit documentation, go online, these are individuals who are busy working, juggling family responsibilities. Maybe they have children, maybe they're part of the sandwich generation, and they have an older person they're taking care of. And it's just about putting up a barrier to stay enrolled in a Medicaid program or to enrolling in Medicaid in the first place. And so we're anticipating, or not we're anticipating, the CBO estimates that at least 5 million people are going to lose their coverage even though they would be eligible because of these work requirements.
Now, if they're working, how do they fall into eligibility for that benefit? What type of worker are we talking about? You gave examples of someone who's a dual caregiver, but what are they doing so that they kind of fall in between that crack?
Yeah, and so it's individuals that maybe they're gig workers, so they're freelance workers and they're, working from job to job, or maybe they're individuals that have multiple part-time jobs that don't offer employer coverage. These are individuals that may be much lower income and aren't offered health insurance, or they may just have work for an employer that doesn't offer coverage or be a freelancer, et cetera. And so these are individuals that are at risk. Also, even with some of the exemptions, whether someone is in school or in some type of job training, like how do we know that states are going to make it easy for people to even report their work requirement or their exemption, et cetera? And so the CBO has scored that as at least 5 million people losing their coverage. And we know that the disproportionate impact is going to be on older people, 50 and over, that may have encounter barriers to having steady employment.
So then what does this look like moving forward? What can people do to arm themselves to be prepared for what's coming next?
So I think that's what's really tricky is that, for someone who is enrolled in Medicaid, depending on where they're living and how the state, Medicaid agency implements the rule, it's going to be extremely challenging. How are they going to be notified that they have to report this work requirement? Is it going to be electronic? Is it going to be paper? What is the reporting requirement going to look like? Is it going to be online? Are they going to have to go to an office? I think these are just unanswered questions right now. I think also what's very concerning that a change that's going to take place for people who are enrolled in Medicaid, who are enrolled as part of the Medicaid expansion population. So these are individuals that are eligible for Medicaid. They're under age 65. They may be enrolled in a state that expanded Medicaid to ensure that more people in the state had health care coverage. Those individuals are going to have to prove they're eligible more than once a year now. And the calculation for what the government would save on spending for healthcare is simply due to the fact that having to apply for benefits and reapply for benefits continuously inevitably will end up cutting people off because they just get caught up and strangled in the red tape.
And just speaking of the red tape, what does proof look like? Or are you not sure what that even looks like yet?
Well, I think we have currently enough examples about how difficult it is to apply for and enroll in benefits now to understand how this is going to be complicated. So depending on, where you live, you may have to fill out forms to apply for health insurance. And in some states, those forms can be longer forms than other forms. There may be easier systems online to enroll in some states and not in other states. So it can vary state by state about how people access these benefits. In some states, you must go in person. Some states you can mail in an application. So it really can really vary. And we do know that when it is time for people to recertify for their benefits, that sometimes the paperwork gets lost or it doesn't arrive, or you send it in and you're missing some information, and then you don't learn about that soon enough and your benefits get cut off. And I always look back to the public health emergency, and it seemed like there was this moment where there was general agreement from state agencies, from the federal government, that we needed to do everything that we could to keep people on health insurance, to keep them healthy, because that was important. And so we, as a country, we've made the rules, we had made the rules more flexible. We had said, okay, if a state agrees to accept some federal funding, you have to keep people on their Medicaid coverage because we want them to be insured. And this is essentially just going in reverse. I mean, so, for many of us who have spent years advocating for healthcare as a human right, for trying to reach everyone in the United States with healthcare coverage, whether that's ACA-based coverage, Medicaid coverage, Medicare coverage, um, this is a huge setback.
So I don't even know what are you supposed to do, because I'm also thinking about the piece. What if you do have a disability and you're dyslexic, for example, or what if you're an overwhelmed mom who's caregiving for your parents as well as your children and you don't have time to fill out forms? I mean, there's so many what ifs. Um, so what now? I mean, one of the pieces of this podcast is that you want people to be able to empower themselves. I want to give people a lifeline because things seem so dire right now.
Yeah.
I have something called the power play, which is
Mhm.
what are 1 to 3 tips that you would recommend to somebody to say, hey, this is how you can prepare yourself. This is where you can get help, or this is how you can help someone you love who may not even know that this is what they're going to be facing.
Yeah, Robin, I love that. Well, first, let's look at the safety net. Even though this bill is an attack on the safety net, there are resources out there for people to seek who need help. So if you're on Medicare, there's a state health insurance program. These programs can assist people with learning about and enrolling into very important benefits. So I want to encourage people to seek out help from the community-based organizations that serve older adults, or the community-based organizations that serve families of all ages, to learn about what they need to be doing. Keep in mind that some of these changes are immediate and some of these changes are further out. So the work requirement changes, those are further out. Those are going to be in 2026. So there's some time. These Medicare changes that I mentioned, those are more immediate. So if someone is struggling to afford their Medicare coverage, there is assistance available, but they're going to have to seek it out, unfortunately. And we're going to be doing our best to reach these people too. So seeking out that assistance, people can call our helpline at 1-800-333-4114. If they have Medicare questions, and we can point them in the right direction and provide some assistance. I also want to mention that what the bill did not do was it did not extend some of the premium tax credits to make the Affordable Care Act plans more affordable. So these are the subsidies that lower the cost of the monthly premiums for people who are enrolled in the qualified health plans through the Affordable Care Act. What we are going to be advocating for is that Congress extend these tax credits before they expire. And maybe there's a chance that that will happen towards the end of this year in a big mega healthcare bill. And so that's what we're going to be advocating for. And so I think it's important for people to first know that this is going to happen, that people will be paying more for their healthcare. They're going to lose assistance if these tax credits are not extended. And so people can still reach out to their representatives and tell them that these need to be extended and Congress needs to find a way to do it. And so that is something that we can still prevent. And it's sad and it's unfortunate that they weren't extended as part of this bill, but that is something that can still happen, and we really need to focus on that.
Thank you so much. I appreciate the resource and the clarity. And what's really needed now is people need to understand what exactly is happening. Thank you for all of the work you do. Again, you're a national organization, so people can reach out to you and you act as a guide. Your organization gives information to people.
And I always like to tell people, please, please do not count yourself out. Medicare is confusing. Our healthcare system is difficult to navigate, but don't count yourself out. Ask questions. If you hear something from someone that may not be accurate, please, reach out. You can call us at 1-800-333-4114. You can call 1-800-Medicare to get good information, and you can call your state health insurance program to get good information, because Medicare is confusing, but it's important for people to know that Medicare is available, that people still qualify for it, whether someone is fully insured and has worked and has Social Security quarters for 10 years, or whether they're a green card holder and they've lived in the United States for 5 years. I don't want people counting themselves out, and that there is assistance out there that can help make their Medicare more affordable, and just to make sure to, ask questions and ask for some help too.
Awesome. Thank you so much. Frederick Riccardi, president of Medicare Rights Center. Thank you so much.
Thank you, Robin. I really appreciate it.
Now it's time to recap Frederick's top power plays to make sure you know what you can do so you and a loved one can be armed with knowledge and hopefully protect yourself as much as you can from these cuts. First, check your state's health insurance program if you're on Medicare. There are people out there who can help provide assistance in terms of your coverage. Also, understand the new work requirement if you are on Medicare, because that could impact your coverage immediately. And finally, if you don't know what to do, you can call the Medicare Rights Hotline at 1-800-333-4114. The good news is there are people out there who can point you in the right direction, especially if you feel overwhelmed and don't even know where to begin. Thanks so much for joining us. We hope you're feeling a little more hopeful, a little less stuck, and maybe even inspired to take action, because democracy does work when we all participate. Want more? You can go to my website, democracydoes.com, and sign up to get our newsletter, alerts on when our next episode drops, and as a bonus, you'll get a free community engagement toolkit with ideas on how to get involved at your comfort level. Let's get in the game together. Until next time, I'm your host, Robin Hamilton.